This procedure provides a simple, reliable, and inexpensive method to quantify muscle strength for patients during and after critical illness. First, position the patient in a sitting position. Determine whether the test range of motion can be completed against gravity. Then determine whether to provide resistance or change the patient's position to eliminate the force of gravity. Finally, provide resistance or palpate the muscle or tendon and assign a muscle strength grade. Ultimately, results can be obtained that quantify muscle strength through manual muscle testing.
The main advantages of manual muscle testing over existing methods, such as isokinetic testing, are that it is easily performed without additional equipment and can be administered in many settings, including the intensive care unit, outpatient clinics, and patients' homes. Standardized manual muscle testing can be utilized in the diagnosis of ICU-acquired weakness, provision of rehabilitation therapy services, and as an outcome measurement in research studies. It can be reliably performed with appropriate training by both clinicians and non-clinicians.
Grading of muscle strength follows the Medical Research Council system. Test each muscle group bilaterally. First, ensure the patient is sitting upright and positioned to allow full movement of the joint against gravity. For each muscle tested, stand to the side being tested. Demonstrate the desired movement against gravity. Then request the patient to repeat the motion. If the patient can move through the desired range of motion against gravity, apply resistance in the testing position while